Hi, I'm Savannah. I'm going to be doing my immediate care of a newborn skill today. I'm going to make sure I follow my GPSBs, 11 rights and 3 checks. The first thing that I'm going to do for the newborn is I'm going to put the baby in a position that facilitates drainage. So I'm going to kind of turn the head to the side. I'm now going to suction the mouth and then the nose. And then I'm going to continue to stimulate the baby, making sure to get them really good and dry. At this point in time, you want the baby to be crying really loud. It's the natural instinct for the baby. So now I'm going to go ahead and change the linens. And I'm going to put the baby on a warmer and going to go ahead and place a little cap on the baby. So now the first thing that I'm going to do is I'm going to go ahead and do the APGAR, the 1 minute APGAR. You do it at 1 minute and 5 minutes. I'm going to go ahead and start for the 1 minute. So the first thing I'm going to do is I'm going to listen to the apical heart rate for 1 full minute. Okay. After I do that, I'm then going to watch the respiratory effort of the baby and make sure the baby's not doing in any abnormal breathing. I'm then going to check the muscle tone of the baby. You want to make sure the arms are kind of bunched in instead of having the arms just relaxed out to the sides. And then I'm going to check reflex irritability for the baby. So what you would do is you could gently flick the bottom of the baby's foot, and if the baby pulls that leg in, you know that the baby has the reflexes. You're then going to assess the color of the baby. So you're going to you want the center of the baby, the trunk of the baby, and the abdomen. You want most of that all to be pink. It's okay at the 1 minute APGAR for a little bit of bluing around on the fingers and the toes and a little bit around the mouth. That's okay at the 1 minute APGAR, but you want most of the baby to be pink. And then you're going to go ahead and check the umbilical cord. So there's going to be a clamp on the umbilical cord. You're looking at the clamp for there to be no excessive bleeding. And you also want to make sure that there are 2 arteries and 1 vein in the umbilical cord. At this point, I'm now going to get vital signs on my baby. So I'm going to check the heart rate. And I'm going to listen to the heart. And then I'm going to listen for 1 full minute to get that heart rate. Then I'm going to check the respiratory rate of my baby. I'm going to watch for 1 full minute. I'm then going to go ahead and get a blood pressure on my baby. I'm going to do it on the lower leg. I'm going to make sure that any equipment that I use is the appropriate size for my baby. So I'm going to put it on the lower leg. Okay. And then I'm going to check the axillary temperature, which would be under the arm for my baby. You want to make sure that you don't do any rectal temperatures on a newborn. I'm then going to go ahead and check the baby like head to toe assessment. So I'm going to be looking at the baby's head. I'm going to look for any molding or any cephalehematomas. I'm then going to set the baby up in a seated position, and I'm going to check the anterior and posterior fontanelles to make sure they're flat and you don't want any sucking in or like bulging. I'm gonna put the baby back down. So now we're gonna check 3 reflexes on the baby. The first one that I'm gonna do is I'm gonna do the Babinski reflex, which would be you would take your finger up to the pad of their foot, and you want the baby's toes to kind of spread out and go outward. You don't want them to like curl down. The second one we're gonna do is the startle reflex, which would be if I kind of clap my hands over the baby if they startle. And then we're also going to put the finger in the mouth and see if they have the sucking reflex. See if they can, once you put the finger in, if they go ahead and start sucking on the finger. So now at this point, I'm going to go ahead and make sure I put the bracelet on my baby. And mom and baby will have the same bracelet. It'll have identical numbers on it, so that way you know that the baby and the mom go together. So I'm gonna go ahead and put on the bracelet. So now at this point, I'm gonna go ahead and measure the baby. Take the cap off for this part. And you're going to measure all the way down. We're at 21.5 inches long. And now we're going to go ahead and weigh our baby. So at this point, we took off the cap. We are now going to transfer the baby onto the scale. And before we put the baby down onto the scale, we would zero the scale out, lay the baby on the scale, and I would then keep my hand above the baby, not touching the baby because I don't want to disrupt what the scale says of the weight of the baby, but keep my hand above the baby just in case the baby was to move around or try to fall out of the scale. Okay, so now that I have, I'm gonna transfer my baby back to the bassinet. So now that I have done this, I am going to go ahead and administer the eye prophylaxis. So the first thing I'm going to do is take a moist cotton swab, and I'm going to clean the baby's eyes. And then I'm going to administer this prophylaxis in the lower conjunctival site. So you want to pull down the baby's eye and put it in that lower kind of pocket. And you're going to do that on each side. Now we're going to perform the vitamin K shot on our baby. So what we're going to do is we're going to make sure that we put that in the vastus lateralis. First things first, I need a alcohol swab. So we're going to make sure we're putting that in the outer, so you're going to section the thigh into thirds, and you're going to put it in the outer middle third of the baby's thigh. So you're going to turn a little bit, and you're going to clean the site, and then you're going to inject the vitamin K shot into, like I said, the vastus lateralis, the outer middle thirds of the thigh. And then I would engage the safety and put it in the sharps container for demonstration purposes. I'm going to save this needle. So now at this point, I'm going to put a diaper on my baby. I'm gonna swaddle the baby. Oop. Get your little hands in there. All right. It's not my best swaddling job. Then after I swaddle the baby, I'm going to make sure, before I swaddled the baby, I would go ahead and do the Apgar again, and that would be the 5-minute Apgar. Okay, so now I'm going to swaddle my baby, and then go ahead and give the baby back to mom. And I'm going to remove my gloves, perform hand hygiene, and report and record everything that I have done. Thank you.